This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Hi.
Hi.
Okay. Hello. Welcome back to our episode. She is the night. I am the day.
Well, we tried being vampires for this episode for what will be obvious to you all. Why vampires?
And I was very clumsy. I keep looking at here. I was very clumsy. And
I had gotten us these to wear.
Yeah.
And clearly we're not wearing them because...
Wait, you're looking here.
Yeah, clearly we're not wearing them because...
I decided to open the package like a savage, and I was actually trying to be very careful, believe it or not, and one of the little teeth went down the drain. So I wasn't going to come on here with a little snaggle tooth.
So I figure we'll just be like true blood vampires that just like on command they...
Yeah, but Jules looks like a vampire right now, but in person, she does not.
I know. The camera is not being very friendly with me, but I guess it heard me that, oh, you want to be a vampire? Okay, got you. White.
Stark difference, yeah.
Guys, go to YouTube, subscribe, do all those things. I'm doing the podcasting. Anyway, but if you see us, you should because it's, I mean, yeah, it's dark.
Yeah.
Yeah.
All right, so today's episode, we are going to talk about porphyria.
Wait, who are you?
Oh, yes. All right, I'm Evie. This is Jules. Sorry, I didn't turn this to you.
I don't care. That's fine.
All right, I'm Evie. This is Jules. And today we're going to talk about the vampire disease, a.k.a.
Porphyria.
porphyria.
All right. Well, the vampires don't do that, but I don't know.
And vampires don't do this. Okay. All right. Okay.
I guess they like sultry look at you.
Oh, yeah, they glamour, right? All right. So, porphyria.
Had you heard of it before?
Yes.
Okay, good. All right.
So I do know about porphyria, but given that this is our Halloween episode, it's going to be a little bit of like medical facts with a little bit of a Halloween twist. She's so excited. She loves the Halloween.
I
the
love Halloween.
episode.
I love like dressing up for it. I love doing this. I am okay.
Check out her costume last year. She was
Cleopatra.
the Egyptian Cleopatra. Yeah. And
But-
she looked bomb.
But anyway, I mean, I love all of this. I'm not an expert by any means in makeup. It's like Bailey Sarian put it perfectly. I'm like a Monet right now. From far away, looks pretty like spot on, like what's going on here in my face. But up close, very different. The
Looks
details,
really good, though.
the details are.
Looks really good. I don't know what color you did under your
I
under
mixed
eye.
it. I did like a dark red and then like a bright red.
It looks great.
Thank you.
Yes.
Because I was really like hoping for the best here.
Oh.
I mean, but you just look so beautiful. Look at her. Can we all appreciate
It's
her?
the red hair. It is the red hair.
No, but it's just everything. And it's the bold lip. And then it's the
Julie
cat
loves it when I
eye.
wear gold.
I fucking love it. Like, she has beautiful lips and they're natural. Like,
They are.
you know, it's just like,
One
look
day
at her.
I'll get something.
I look like I'm, you know, Grim Reaper style.
That
And
she's
she,
not. She's
and
so
she looks
mean.
gorgeous. Like, you should like frame this. Like, it's just.
Jules. Thank you.
I'm just okay. Anyway, porphyria.
She looks great too, guys.
Porphyria.
She just really likes my bold lip.
I really do.
Yeah, she really likes my bold lip. That's what she's really good about here. Because she told me, she's like, I freaking love your bold
I know.
lip.
Before we started recording, I'm like, it looks so
Because
fucking
I
good on
never
you.
wear a bold lip.
I know. She's a neutral girly.
I am
Like, you know.
very neutral. All right, so porphyria. It's not. It sounds magical. It's not magical. But it does have a little bit of a spooky reputation. In reality, porphyrias are a group of really rare genetic disorders of blood pigment production. They disrupt the body's ability to make heme, the iron-containing part of hemoglobin that gives blood that red color and carries oxygen. The name porphyria comes from the Greek porphyra, meaning purple, and not to the purple red porphyrin pigments can have. When one of the 8 enzymes in heme synthesis is missing or malfunctioning, the intermediate chemicals porphyrins build up in the tissue and cause symptoms. These symptoms mainly involve either the nervous system in acute porphyrias or the skin and light sensitivity in cutaneous porphyrias. In short, porphyria is a genetic traffic jam in the blood factory, and when that step is blocked, raw materials pile up and spit it out, causing trouble. Now, how heme production fails, what is it exactly that happens? Your body makes heme in the liver and bone marrow. It takes 8 steps. Each step needs a specific enzyme. In porphyria, one enzyme works poorly because of a gene change. The chain stalls everything. Unfinished building blocks build up. So these chemicals irritate the nerves and the skin, and they can make urine or tissue look reddish or dark. The specific enzyme problem determines the type of porphyria that you have. Some types cause sudden belly pain, which is the one that we study a little bit more, and also nerve symptoms. Others might make the skin painful in the sunlight, which is the other really popular porphyria. Now, heme does matter. It holds onto the inside hemoglobin and helps red blood cells carry oxygen. And when the body can't make enough heme, symptoms appear.
So there are certain types of porphyrias, and they're kind of like classified broadly by which body system they generally affect. Acute porphyrias are like neurovisceral. These mainly cause sudden attacks of pain and nervous system symptoms. They are often triggered by hormones or drugs. The common acute form is acute intermittent. That's another word to add to the list.
Intermittent.
Yeah, porphyria, or AIP. Other acute types include hereditary. Hereditary. I was already trying to get to the other word, and I'm like nervous, intimidated by the other word. So I'm like, okay, hereditary. That cop. Okay, I'm gonna try. Porphyria.
Yeah, porphyria. It's actually a hard word to say.
It's weird. It sounds weird. Anyway. HCP, variegate porphyria, VP, and rare enzyme deficiencies like ALAAD deficiency porphyria. In acute porphyrias, attacks can cause severe abdominal pain, vomiting, and neurological signs. Cutaneous? That's another word.
Cutaneous. What?
I can't say that word.
Cutaneous. Like what? I'm giving you like a cowboy hat. Cutaneous. Cutaneous.
Porphyrias.
Cutaneous. I was like.
Cutaneous porphyrias. And skin photosynthesis. Oh, wow. Photosynthesis.
Man. Today's the day.
All right. All right. Or skin photosensitivity. I want to say photosynthesis.
Cutaneous porphyrias or skin photosensitivity.
That's a lot of... Okay. To my defense. Anyway. So these cause skin symptoms from light exposure. The most common porphyria,
Cutaneous target.
There, PCT, which leads to blistering and fragility of sun-exposed skin, often the back of the hand. So you could kind of get the gist of why this kind of like leads into the lore of the vampires were kind of like tied into this because like if they have like this photosensitivity, and like the blistering and whatever. That makes sense.
All right, so symptoms of acute porphyria attacks. When acute porphyria flares, the symptoms hit quickly and can be pretty intense. These are usually very severe. Anyone that is complaining of such a severe abdominal pain and we rule out that it's anything surgical, porphyria should kind of come up on the list. So common features include severe abdominal pain, often really sudden, crampy, intense, just like me last night.
I know. Can we also, now that you talked about it, this woman here was last night, we're talking, this is September 20th. We're recording ahead of time because that's our lives. That's the only way this could happen. Anyway, she was in the hospital till like 3 something in the morning last night from abdominal pain, and she's here recording, and we're in the 3rd episode now.
Woo, 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 woo.
Round of applause, everyone. Please. Thank you.
Yeah. Thank you. I try. I wasn't sure. I wasn't sure if I was gonna make it.
She's clearly,
I'm better.
She's clearly fine. Things are okay. It was for an abundance of caution,
Yes.
you know, to check out that everything's fine. And luckily, so far, knock on wood, she's okay.
You will also have digestive issues when having an acute porphyria attack.
I'm like, what?
I mean, I did. I had a lot of nausea and vomiting too.
Well, yeah, you're right. Yeah.
All right. So, but back to
porphyria.
The digestive issues are going to be nausea, vomiting, or even constipation. The muscle and limb pain or weakness can also happen. Tingling, numbness, or even paralysis of the arms and legs, neuropsychiatric changes, anxiety, insomnia, hallucinations, or confusion. Those are all symptoms that you can feel with this. And also, dark reddish brown urine is also something very clinical that we look at for porphyria. Now, it is caused by excreted porphyrins, and I'm not sure if it's pronounced porphyrins or porphyrins, but anyways, often turning dark on standing. So if you just leave it alone, it turns into a dark because it's that accumulation of these excreted porphyrins. So the autonomic signs is rapid heart rate, high blood pressure. In severe cases, you can even have seizures and even a coma can occur. These attacks can last days or even weeks if untreated, and only about 20% of people with acute porphyria genes ever experience a full-blown attack. Now, cutaneous porphyria causes reactions in sunlight or bright indoor light. So it's not just when they walk outside, it's any kind of really bright or maybe intense light.
Definitely not a good one for here right now.
Yeah. No, you wouldn't be able to live here. Yeah. Erythropoietic protoporphyria.
I'm so glad you're saying this portion.
Erythropoietic proto. I keep on saying porto.
I wouldn't be able to say it, period.
Erythropoietic protoporphyria, EPP or XLP. This type of porphyria is when patients feel tingling or burning in sun-exposed areas of the face, hands, and within minutes of light exposure. You can have redness, swelling, and tiny purple spots often appear as well.
Yeah, you can see how like vampires would be tied to this.
These phototoxic reactions are extremely painful and may last even many days. And over time, repeated sunburn-like injuries can actually cause thickened or scarred skin. They'll have like that different type of texture as well. Porphyria cutanea tarda, which is chronic blistering and fragility of sun-exposed skin, especially in the hands. And obviously, that's probably an area that's more exposed to light. Skin may form blisters and scars easily, and hair growth can increase, especially on the face. There is also congenital erythropoietic porphyria, so CEP. This is a very severe childhood form. Infants often have red-stained diapers, dark urine. Light exposure causes severe blistering and disfigurement. Patients may have loss of nasal or ear tissue and darkly colored teeth from the porphyrin deposition. And anemia and enlarged spleen can also occur because it's that problem of those steps of making those blood products. No matter the type of porphyria, those symptoms can mimic other disorders. Special tests are needed to confirm that diagnosis.
Right. That for my part.
Yes, the history and the mystery.
Well, I love that. History and the mystery.
I rhyme sometimes.
That could be a new little segment. I love that. Check out the Plants and Facts has been out now.
Yeah.
But maybe history and the mystery. Okay. Anyway, so in this case right now, we're going to be talking about the mythology and the history of it all because, there's like all those like lores of the vampires and the mythology of it all and whatnot. And now that you kind of know a little bit about porphyria, you kind of see like where it's coming from. Mm-hmm. If some people had this back then and had no idea what the heck was going on, you know? So vampires in real life. Porphyria's nickname is the vampire disease, and there is some overlap with legends. In Eastern European folklore, for example, people with porphyria-like symptoms may have inspired vampire tales. So for example, like what we were talking about, the sunlight aversion. Porphyria patients often avoid sunlight to prevent painful skin damage. Over generations, this habit could fuel legends of nocturnal vampires. One researcher notes Romanian Prince Vlad the Impaler, the Dracula inspiration. He, quote unquote, aggressively avoided exposure to sunlight and due to sun hypersensitivity. So, I mean, that was so long ago. Vlad was like in the 1400s. So, I mean, God only knows if it was a porphyria, you know? Repeated skin attacks can reseed the gums, therefore like exposing teeth-like fangs. And, you know, that's like very striking, you know?
Yeah. Mm-hmm.
And then there's a aspect of like that quote unquote drinking blood. During attacks, urine often turns dark red or brown. And medieval observers might have mistaken this for blood drinking. People back then, medicine was so like rudimentary that they must have been like, whatever's coming out of you is because that's what you drank it, you know? And they're like, urine, blood. Oh my God, instead of like it being yellow like normal urine, it looks like blood. That means you drank blood. You know, it's like, okay, well, I mean,
you're a vampire.
Right. You drank blood.
Yeah.
Probably not. Clearly, you know, could have been porphyria. In the 1800s, some physicians advised patients to consume animal blood even to like treat anemia, which reinforced even more that myth. And then there's the garlic and crucifixes of it all, right? So folklore says vampires fear garlic and crosses. And interestingly enough, garlic contains sulfur compounds that can trigger porphyria pain, giving sufferers a reason to avoid it. And in the 17th and 18th century, some people with strange ailments, probably porphyria, possibly, maybe, we don't know, were labeled as vampires by authorities.
That's crazy.
Isn't that crazy?
Yeah.
So because of these overlaps, porphyria is sometimes called quote unquote vampire disease. Bram Stoker's Dracula in 1897 popularized the archetype of the vampire through medical recognition of porphyria, although medical recognition of porphyria came soon after, with formal classification in 1911. Even famous historical figures get mentioned. For example, King George III of England had episodes of quote-unquote madness in the late 1700s. His symptoms were once attributed to porphyria, though modern scholars maybe debate this. All this history makes porphyria a good spooky season topic. But remember, the science of porphyria might possibly explain these eerie stories from back then and like where these myths came from.
Yeah. It's so, and like living back then, and I don't know, you have something that probably you have no idea what it is, and it's rare, it's genetic, so maybe if your family had it, maybe they shun you or something.
You imagine
that's the daughter of so and so.
You imagine back then there was a lot of inbreeding in the royal lineages and whatnot, and there was a lot of hemophilia passed down due to all of that inbreeding. You imagine like what they must have even thought of hemophilia, and that's pretty severe.
Yeah, I know.
So imagine that. Like, it must have been like, oh, we're cursed or whatever, you know?
I know.
So crazy stuff.
All right, so let's talk a little bit about causes and triggers. And so porphyria is usually inherited as a genetic mutation in the heme enzyme gene. Heme is, again, that part of hemoglobin that is going to help carry oxygen. Most forms like AIP, HCP, and VP are autosomal dominant, and all of those that I just mentioned are the different types of porphyrias. Most are autosomal dominant, so one parent with the mutation can pass it on. It's going to be a dominant gene. The one exception is congenital erythropoietic porphyria, which is a recessive, meaning that if you pass it down, you need to have another recessive in order, like from the other parent, in order for that to be able to be passed down. Now, again, inheriting a mutation does not guarantee symptoms. Most carriers never have an attack. Various factors can bring on an attack or trigger porphyria by demanding more heme production and stressing the body. Drugs, certain medications, for example, barbiturates, sulfa drugs, which is the whole entire thing with the garlic. Okay?
Exactly. It's nuts.
Yeah, I know.
Garlic.
Yeah. I mean, there's some people that have like other enzyme genetic mutations and things like that, and sulfa drugs can trigger them to go into in a crisis.
Interesting.
And even certain types of foods as well.
Well, yeah, especially, I mean, if they have anything like that compound,
Exactly. So anesthetics, anti-seizure medications, or even anti-nausea medications, birth control pills, all of those can precipitate an attack. Hormones can also play into this. Cyclical hormonal changes like menstrual cycles or pregnancy often trigger acute attacks as well. Low calorie or low carbohydrate intake can induce attacks as well. Alcohol and smoking, so excess alcohol or tobacco use are also common. Severe illnesses or stress can also precipitate these acute symptoms. Now, for Porphyria cutanea tarda is somewhat different. It often arises from acquired factors piling up. Common risk factors include estrogen, birth control, or even hormonal therapy, heavy alcohol use, iron overload, hemochromatosis, hepatitis C, or HIV infection, and even smoking can do this.
Cue in my hellhounds. Sometimes I'm a vampire right now.
Yeah. Hellhounds.
Yeah. Oh, we're howling now.
What are you howling at? PCT may develop if these factors disrupt liver heme production. And in summary, porphyria itself is a genetic blueprint, but whether it activates depends on the lifestyle you live, hormonal changes, and other stresses that can bring on those triggers.
So diagnosis, how could you possibly identify this? If you're a practitioner or
Needs testing.
pretty much. Because porphyria symptoms are diverse and even mimic other conditions, physicians use special tests. The key is finding elevated porphyrins or precursors in blood, urine, or stool. For an acute attack, a urine sample is tested for high levels of, I really wish that you were reading this section instead, aminolevolinic.
Okay,
acid.
amino. It's just amino.
Aminolevolinic
acid.
ALA.
Yes.
And
Porphobilinogen.
PBG.
ALA, PBG.
There we go. They're in labs, okay? And they're going to be put as ALA or PBG, okay? Yeah. So there we go.
No one's going to remember probably what ALA and PBG stand for, or at least not the regular person.
I had never seen it. I had seen ALA, but I had never seen the full name of it. I was like, interesting. Anyway, so normal values are near 0. In an attack, they can spike many times above normal. Chronic cutaneous. Cuticle, right? So cutaneous.
Cutaneous? Cutaneous.
Cutaneous.
Yes, much better.
Cutaneous.
She's like, cutaneous. Wrong.
Okay. Porphyrias are diagnosed by measuring porphyrins in blood or stool. Genetic testing can confirm the exact enzyme gene mutation and help screen family members.
A little bit just touching on the treatment and management of it. Porphyria doesn't have a cure, but often you can manage to lessen the symptoms during an acute crisis. And care really depends just on the type of porphyria that you have. For acute porphyria attacks, patients are usually hospitalized for supportive care. The main therapy is going to be intravenous hemin, which is an injectable form of heme, which calms the overactive porphyrin production pathway. Pain, nausea, and seizures are also treated symptomatically. You can use pain relievers, anti-nausea medications, and even anti-seizure medications as well. Intravenous fluids and glucose may be given as well. Doctors also identify and remove the triggers, stopping the offending drug. Maybe you were started on an antibiotic and you stop that. And also ensure that you're having adequate calories, because your diet can also trigger that as well. To try to prevent recurrence. For recurrent prevention, a newer monthly injection called givosiran is also available.
Yeah. God bless you.
Thank you. Thank you. Yeah. I love how we both thought about that.
Exactly. That's kind of why I said it sarcastically. Like, anyway. Oh, I even saw a vampire movie last night. Because it's all over TikTok. TikTok was pressing on me hard on the algorithm. Dracula Love Story Told or something like that.
I haven't seen it.
Bro, obviously our algorithms are severely different. It was every 3 videos, it was another thing of it.
Oh my my God.
And I'm like, I need to see this movie. Like, I need to see it. So I finally saw it, and it's beautiful. Dracula, his love. He waited 400 years to see her again.
Oh.
It's amazing. It's such a beautiful love story. I love it. And now I'm like on withdrawals. Like, I need another movie or
Like
another
that, like
something
another
like
sap
that.
movie.
Like something like that about
Fill my
that
heart.
yearning of that gothic love of urine. Like, I want you, but I can't have you, and then like I need that. I can't stop thinking of it now.
I can't.
Thank you, TikTok.
Yeah,
Anyway.
I can't think of another movie like that.
I can't either. I can't. I'm like looking all around. I'm gonna have to make a TikTok and ask people to like please like send me recommendations
Yeah.
or something, because I'm on withdrawals now.
Maybe like an Edgar Allan Poe.
Oh
type
yeah.
of
I know.
Shakespeare.
Yeah. Yeah.
Maybe.
Yeah.
I don't know. Anyway.
Anyway.
Okay. So now the cornerstone. Cornerstone. The cornerstone.
We're both having a moment here. There's a lot of in this episode with the
difficult words.
yeah.
The cornerstone is sun protection, avoiding UV and visible light, sun and bright indoor lights as well.
Definitely would
going
not
to be
do
critical.
would not do good in my house with all the grow lights that I have growing around.
No, Julie. This room.
Well,
is
right now
a
for
beam.
recording.
Yeah, is a beam.
For recording, it definitely is. Check out our Instagram.
If we
I mean,
real
our
vampires,
socials.
we'd be like,
No, we'd be dust by this point. But check out our social medias, particularly for Funny Medicine Anywhere. I post like behind the scenes of how crazy our lab looks.
Yeah.
Because it's like we have ring lights, we have square light, no, rectangular lights, we have like
whatever. it's
cylindrical
called.
lights.
Yeah.
All shapes.
Bar lights. Yeah.
And then we have overhead lights.
we have those lights.
It's like hotter in here just because of the freaking lights.
Yeah.
And then on top of that, I have my grow lights for all my plants.
Yes.
Because they require their spectrum for it.
Yes. It's adorable.
So clearly we're not vampires, is what I'm trying to say.
Oh my God. So that's why you have little grow lights.
You didn't know that?
I just realized it. Like, now I'm like,
Yeah, I have to. Not that they'll die.
They'll
It's too
die.
dark in this room.
yes.
Mind you, this room was my childhood room. I can't escape this room. Now I'm back in here. Childhood room growing up, and I only have one window, and the window sucks because on top of that, it's a window that's under a canopy. So the light that comes in here is abysmal. Like, it's barely anything that comes in here. Okay, it could be freaking the middle of the day, super bright here in Miami, and in here it's dark as shit. So I have to like compensate for all my plants because I need plants. So yeah, there's the grow lights. Wow, I went on a tangent. I'm sorry about that.
It's okay.
But clearly we're just not vampires is what I'm trying to say, because there's a lot of UV light.
In case there was any confusion.
Trying to keep it Halloweeny, okay? It's Funny Medicine on Halloween.
Just in case if you had some thoughts that we were vampires, we're not.
I mean, this comes out on October 28th, right before Halloween. Happy Halloween. I hope you guys are carving your pumpkins. Hope you guys are like doing all the lovely things that I wish I could be doing.
Okay, so back to Porphyria. We're not ending the episode yet. So, finishing off on the UV sunlight, patients should use protective clothing, and sometimes window tinting is going to be important, or like Jules, have a canopy outside, since ordinary sunscreen may not fully block the wavelengths and trigger porphyrins. Now, for EPP or XLP, an FDA-approved implant called afamelanotide, or also called Sines, can also be used. This small subcutaneous implant placed under the skin every 2 months, and it increases melanin and provides partial photoprotection. That is so cool.
And you want that like yesterday.
Huh?
And you want that like yesterday.
Yeah.
Because you're all about like sunscreen and everything.
Sunscreen and everything, yes. Okay, all the time. 100%. You'll never catch me outside without it.
Mind you.
Or inside, really.
Look at how we look. If you're watching on YouTube, look at how we look. She is naturally, like, just natural, beautiful, golden tan at all times. It's just, she's born like that.
I actually don't tan golden. I like tan like burnt toast.
Whatever this is.
I don't have an Australian gold.
Oh,
this is a lot of bronzer.
no, look at your neck. Look at my neck.
Maybe some irritation, but
Well, yeah, I mean, we're all irritated. But anyway, like, look at this.
I'm a medium skin tone.
Yeah, and
You're not.
and mind you, what I'm trying to say here is like, I'm white as shit, okay? I don't wear sunscreen because I hate it and I'm a child.
You are a child.
I'm a child. I know. I'm a child.
need to
I
wear
only wear it on
sunscreen.
my face. And everywhere else I go, I go jogging and whatever, and I don't.
What? You're crazy.
And mind you, and then yet she has this beautiful color that I wish I naturally had, like she naturally has. And she is like,
I am all the time. All the time. And the whiter, the thicker, the better.
it makes no sense. I should be your color. Damn it.
I don't know.
It makes no sense. I wish.
No, but
and I'm here like
I just walk
nothing.
outside like for 5 seconds and it's
yeah, you're like Mario.
dark.
Mario does the same thing. Mario gets a beautiful golden, and I'm here like crisp.
I don't get a beautiful golden. I really get like burnt toast. It's like terrible.
It's
But anyways,
porphyria.
so for PCT, treating underlying factors is also going to be important. Doctors often do regular phlebotomy sessions to remove the iron overload or give a low-dose anti-malarial drug like a hydroxychloroquine not that, I'm mixing it with the tovaquone, like hydrochloroquine. Why can I say that? Hydroxychloroquine.
I wouldn't be able to say shit.
Like hydroxychloroquine to help clear the excess porphyrins. Now, PCT may also improve by stopping alcohol, treating hepatitis C if you have that infection, because that could be a trigger, or adjusting estrogen use if you are somehow intaking estrogen for X reasons.
Yeah.
For congenital erythropoietic porphyria, strict light avoidance is extremely important to limit the blistering. Skin wounds must be cared for to prevent the infection. And in severe CEP crisis, blood transfusions or iron chelation may be needed as well for anemia. Bone marrow stem cell transplants is the only definitive cure for CEP because it replaces the faulty enzyme source and it is used in only severe life-endangering cases. Lifestyle is going to be really important for patients with any type of porphyria. So all patients with porphyria are advised to avoid the known triggers, maintain a balanced diet with adequate carbs, folic acid supplementation, and really careful management of hormones is going to help in certain types of porphyrias.
And when it comes to prognosis and prevalence, like how freaking common is this really?
Yeah.
So rare, as you can imagine, but with a prevalence varying by type, like she had mentioned before. Overall, acute porphyrias together affect roughly 1 in 2,000 to 10,000 people in Europe. So porphyria cutanea, I knew it. I'm like, I'm going to say it how I want to say it, and she's gonna lose her mind over it. It's funny medicine. I'm bringing the funny.
I'm just laughing because we've gone over this.
It won't. It's like adolescence. Like it won't. I know it's adolescence, but I like my brain says it's like adolescence. My brain says it's adolescence. And cutanea. Sounds like a name, doesn't it? It sounds like a name. Cutanea. Hey, cutanea. Come here, cutanea.
You just noticed the one before. You're like cutaneous, right? Cutaneous. How are you like cutanea?
Because it's spelled cutanea. It literally spelled cutanea. Cutanea. It's like cutanea. Why don't you put a fucking Q then? Cutania, right? Cutania? Is it?
No, because you don't pronounce Q.
Quick,
Are we
quick.
Cutania?
Cutania. Cutania.
It is cutania. Oh my god, jokes. My stomach actually hurt from like laughing, like in a good way.
Well, yeah, well, I hope that gives you good
I was
endorphins.
like, no, I can't believe it. Yo, no puedo creer. This fucking girl messed that shit up again. Okay.
I did.
Anytime that you hear cutanea, she's actually trying to say cutania. Or cutaneous. Not cutaneous. Not cutania. I would actually accept cutania. But cutanea. Cutanea. Cutnea.
It looks like cutnea. But anyway,
Anyways.
cutania.
Yes, cutaneous.
Cutania tarda is about 1 in 10,000. And acute intermittent I have a podcast and I don't know how to talk. Okay. I'm gonna see myself out. I'm gonna see myself out. Okay, it hurts. It hurts to laugh now. Well, I'm glad I'm here to make you laugh, okay? You after yesterday's ordeal, you need the endorphins, the positive endorphins. Oh. It's behind my ears.
I'm crying. I'm crying.
Okay. Intermittent?
Yes.
Intermittent.
No.
Intermittent.
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 What the for the love of God? This is so good. So good. Honestly, the best part about this episode is that I'm listening to you.
We did promise funny medicine, right? Here you go, guys.
To be a whole fucking blooper. My reaction every single time. Every single time. Just hit blooper it like
Oh my god.
Oh my god.
It hurts.
I'm literally
It
crying.
really hurts behind my ears.
I can't remember the last time I laughed like that.
Oh my god, ow.
God.
Okay.
I think the last time I laughed like that was when we did that Bugatti one.
Yeah. Yeah. Oh my god.
Okay. Oh
Okay,
my goodness.
I'm trying to
Give me
like
that shit.
Thank you. Yeah. Fuck. I can't. There's too many words here that the only one, thank God, was not in the script was adolescence.
I can't take it.
Adolescence. Adolescence. There.
Okay.
God,
Alright, guys.
that reminds me in New York when I was working for that place.
Yeah.
I'm getting a twitch in my eye because they were like very, you know, and I once let it slip. Adolescents, and they were all like these like white girls. They were all like, what?
What?
What? What'd you say? Huh? Is that your, I get it. That's your Spanish accent. And I'm here like,
No, I just
no, I just don't know how to talk, and maybe I have a speech impediment. Maybe. I should have said that.
Yeah, I was gonna say, I'm like, why didn't you say that?
I should have said that.
Julie today would say that.
Yeah, today's Julie would have said that, but young Julie was intimidated and was like,
We were young.
I was young in a different city and all that, but yeah. Anyway,
All right, guys.
I'm sure you
I'm
feel
gonna
better
take
now.
over. No, yeah, that was great. I haven't laughed like that in quite a long time. So thank you.
That's what I'm here for.
Yeah.
I'm here to bring the funny and the medicine.
Oh my God.
I'm the funny and the medicine.
Yes, I took away the control from her because I'm gonna finish this because if not, we're not gonna be able to finish this. So Porphyria cutanea tarda is
You
about...
see beautifully. Perfect. So just do it.
Just do it. So PCT is about 1 in 10,000, and acute intermittent porphyria may occur in about 1 in 2,000 to 5,000. Now, higher in some regions due to founder effects. Many.
You see?
Many.
This is an episode. It's just an episode. We're going to talk it up to the episode as well.
Sure. So many carriers never show symptoms, so the condition is under-recognized. With treatment and trigger avoidance, many patients tend to manage their symptoms pretty well. Acute attacks can threaten life even if severe or untreated, but modern therapies like heme infusions and the drug that we spoke about before, the givosiran, can have improved outcomes. Now, chronic symptoms like skin damage can often be reduced by protection and medications. Patients often benefit from support networks and genetic counseling as well. Now, conclusion. Porphyria may sound like a Halloween legend, but it's actually a medical condition. And understanding it can help dispel kind of the myths and improve care for others that are affected. And it's good to just bring attention to these rare diseases. We should kind of do these rare diseases. There's a rare disease month, so that could be something.
Oh, I gotta look into when that is.
Yes, I forgot when it is, but it is. There's a rare disease month.
Have you ever treated or seen anyone with porphyria?
I've never had a porphyria patient.
No? Okay.
No, at least not like me personally.
Because I mean, you did have a pertussis case. Check out our Tdap
I feel like
episode.
that would be more common to see.
Unfortunately, now it's going to become even more common. But yeah,
had really rare diseases. But porphyria has not been one of them.
Interesting.
Yeah. Always consult with your medical professionals just in case if you feel like you have these crazy symptoms.
Yeah.
But yeah, that was our episode on porphyria and
aka the vampire disease.
Yes.
And aka Julie not being able to.
Julie can't pronounce shit.
Yeah.
But it's really, really funny. God, that was so good. This whole episode, you just have to cut out the bloopers and make like a montage. 'Cause that was so good.
If you guys were just listening to this, great. Thank you. If not, also check us out on YouTube.
Yes.
I mean, I've been doing some pretty good like graphics and supporting photos and information and stuff like that. So go ahead and check that out. They're available at the same time, same day as the audio version is. It's Funny Medicine Podcast on YouTube. And thank you guys for checking in, subscribe, comment, do all those things wherever it is that you're listening or watching this at. Check us out on all forms of social media as well at Funny Medicine Podcast. If you're not into social media, then email funnymedicine305@gmail.com. Also, she joined socials.
Woo,
Where
finally.
can they find you?
Dr. G Peds.
At Instagram or TikTok right now. And then me, Jules_Kaz with a Z at the end. Same. Instagram, TikTok, all those things. And yeah, leave us a comment. What do you guys think? I feel like this is really interesting. This could definitely explain things from way back then that people used to be like, what the hell is going on? Oh my gosh, it's a vampire or like a zombie or something like that.
These poor people.
Exactly.
Were probably just having these like crises and everyone was like, they're a vampire.
Exactly. Oh my God, they're blistering from the sun. Ah! And it's something like this. So I feel like that's super interesting. Let us know what you guys think. Or if you have porphyria or know anyone that has porphyria, let us know. Super interesting. We would love to.
Yes.
I read the comments. I do read all the comments everywhere, wherever it is that you're listening or following us at. I do read them and I do interact with them. Anyway, we'll see you on the next one and hope you guys liked it.
Happy Halloween. Bye.